Okay, so hi everyone. Before anything, I want to thank you for coming here tonight and showing up. Thank you. It means a lot. Thank you so much. Appreciate it. It's super exciting. I also want to thank you, Juliana, for organizing this event for us. Thank you. And God, I'm super nervous.
Oh, no problem. Let me interview you. So, Renata, how many years have you been working with cats and dogs so far?
I've been cleaning dogs' teeth and cats' teeth for 8 years. It's been a long time. I've seen a lot of dogs' teeth and cats' teeth too.
Yes. And in general, if you have to pick which one is more challenging, cats or dogs?
Well, that's a really good question. Cats are a bit more challenging because they have their own little bubble. They're black or white. It's yes or no. With dogs, you can reason a bit, and then you can manipulate them to do things your way, my way. With cats, it's a lot more challenging. Now that being said, older dogs can be a bit challenging. Just because they're just in their little bubble, they just want to go home. They did not sign up for teeth cleaning, so it's sometimes it's difficult to find that little gap where they let you in and they trust you enough so then we can do what we need to do.
Yeah, I suspected that. But let's start with the hot seat for Renata. I'm gonna start the questions. Everyone, that as soon as you have a question, put it in the chat or the tab, and I will definitely do that. So Renata, first of all, why dental health? What happens if we don't do anything about their teeth?
Well, oral hygiene is important for dogs for the same reason for which is it important for us humans, right? You want to keep the mouth healthy. You want to keep the teeth and gums healthy. Because if not, dental problems starts to happen. Oral hygiene essentially means the same thing for us humans and for dogs. We brush our teeth, we floss, we see our hygienist, we go see our dentist. For dogs, it's a bit different in practice. And it's different for each and every dog. If you have a small dog, it's a challenge. If you have a larger dog, if you have a German Shepherd, it's easy peasy. Their teeth tend to be healthy for a long time. Age can play a role, and then things can go a little sideways. And then in terms of you helping your dog, maintaining good oral hygiene, you might need to pivot at that point. But generally speaking, bigger dogs tend to have nicer, healthier teeth. Small dogs, medium, small dogs, tiny dogs, the little micro dogs, it's a bit more challenging. And then I guess we will get to the details of all that as we move forward. Now, dental problems can happen and often do happen and almost always happen at some point. If they go unnoticed and untreated, then further problems could happen. Hearts, liver, kidney problems, issues. And there's a lot of interesting nuggets here that I want to bring here. Okay, so before I get into that, I just want to say that do not believe me. Do not believe anything I say here. My goal is to just plant the seed. So you do your own little thing. Now, Dr. Google is not always a good idea, but definitely will give you a lot of results if you search things. And this one thing that I will talk about here is one of those things that you do whatever you want with it. It's just a thing that I find it interesting, and I thought I will share it with you. So there's a thing so-called teeth organ chart or tooth organ map or tooth organ chart. It was developed for humans mainly, but it's easily translatable into the dog world. It's based on traditional Chinese medicine. Holistic dentists tend to use it. It's a bit out there kind of alternative idea, but Chinese medicine's been around for a long time, a lot longer than Western medicine. So maybe there is something to this. And then this chart is similar to reflexology in a sense. That is something that we all know. On our feet, on our soul, there are areas that are connected to certain organs. The teeth organ chart is somewhat similar to that. They say that certain teeth, certain areas of our mouth, each area is connected to a certain organ or part of our body. And so just to give you an example, if you do a quick Google search, you'll find a lot of things about this. And then just to give you an idea, the front teeth are kidney, then liver, spleen, stomach, lungs, and then far back is the heart. So based on my personal experience and then the Pearly Whites experience, the majority of the clients that we turn away, and we tell these clients that you need to see a veterinarian and then have extractions done, happens in the back, far back. So those problems often go unnoticed for a long time because they're just too far in the back. No one really sees them. You don't notice the problems there. And so that is the area that is connected to the heart based on this traditional medicine idea. So I don't know, but there might be something, because we do see a lot of dogs with those type of problems, and then heart conditions, heart problems is fairly common. So maybe there is something to this. I don't know.
So basically, as dog owners, we need to be checking the back. I know it's difficult to see. So
Yeah.
I imagine, what is the best way to get your dog used to that, to be inspected often at the back? And also, what is the best age and way to get a dog used to brushing he or her teeth?
Well, the sooner is the better. Ideally, you would start right at the beginning, but whenever you start is great. But if we get into brushing at this moment, here's my thing. Do not brush your dog's teeth unless you are 100% certain that you're not causing pain. If you don't know what's in your dog's mouth, if you're not sure if there's anything going on far back, or if you're not sure if there are any loose teeth anywhere in the mouth, you do not start brushing. No, until you are 100% certain that there is no trouble in your dog's mouth. Now, just to give you an idea, like, imagine that there is inflammation, there is an abscess, there is loose teeth, there are loose teeth. The moment you get into you get into your dog's mouth with the toothbrush, that's a problem. Your dog either going to go, I mean, they might let you do this, but they might just really hate you for it. They can bite you. They can do all kinds of things. They will not let you do this peacefully, usually. And you don't want to cause trouble, right? The intention of brushing your dog's teeth is to do something good, something that helps your dog. So please, 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 before you get into brushing, and I'm a big fan of brushing, but before anything, you need to make sure, you have to be 100% sure that your dog's teeth are in a good condition, your gums are good condition, there's nothing going on that could cause problems and pain.
So
And
I imagine, oh,
stubborn,
sorry, go
right?
ahead. So I imagine this goes a lot with dogs that are a little bit older that we rescue and they come already with some dental issues. So will be the recommendation that before we start brushing the teeth on those older rescues to go to the vet and get a check first?
Yep, absolutely.
Okay.
Absolutely. Absolutely. Do the cleanup first and then start brushing. Also, once you see buildup on your dog's teeth, brushing is, you won't be able to clean those teeth. The best, if you're really good at brushing and your dog lets you do this and there's buildup on the teeth, you might be able to keep that level of buildup on the teeth. But whatever is on your dog's teeth is not going to go away by brushing. So ideally, do the cleanup, have your dog's teeth cleaned, everything is healthy, everything is good, then you start brushing. And then when you start brushing, you do it every day. And I'll tell you why you want to do this every day. As much as, and that this is where usually this brushing business fails, to be honest, because if you don't do it every day, you won't see the result. The plaque on our teeth and our dog's teeth is that slimy thing. That's what you want to remove. That's what we want to remove every day from our teeth. It's such a complex biofilm. It doesn't go away on its own, only by brushing. Like there is no magic. It's brushing. And then if you don't, within 42 hours ish, 2 days, 3 days, that slimy thing starts to turn into hard buildup, tartar, calculus. That's the gray, dark, all kinds of colors, things that starts to accumulate on the teeth. So if you don't brush often enough, it is going to happen. Now, when your dog's teeth are nice and clean, the teeth are shiny, the buildup cannot, like it's hard for the tartar to attach to the teeth. But once the process starts and the teeth are not as smooth, it becomes a rough surface, and it's like a magnet. It's everything attaches to it a lot quicker, and that's why we hear often that this happened overnight. The buildup happened overnight. It's not overnight, but it can be quick. It's from nothing to significant buildup. Sometimes it is quite quick because for the reasons I just mentioned.
All right. So we do it every day. Do we need to use toothpaste for dogs or no need to use toothpaste?
Well, you definitely don't want to use human toothpaste. That's a big no-no. There are all kinds of toothpastes in pet stores. Frankly, brushing is not about the toothpaste. It's the actual removing thing. That's what makes the difference. Toothbrush is just a little added something. I personally, we at Pearly Whites, we like to keep things simple. So simple and clean. So we recommend coconut oil. We all have coconut oil at home. That's perfectly fine. It's not so much for the teeth, it's more so for the gums and for the overall body. Simple coconut oil, that's perfectly fine. If you want to be super, super, super like awesome, then I'd like to show you this guy. It's called Love Bug. It's a probiotic powder. And then all I would do is to sprinkle a bit on the toothbrush once the coconut oil is on it, and then brushing the teeth with the coconut oil with the probiotic powder. So then the powder is activated in the mouth and starts working in the mouth first, and then your dog is going to swallow the whole thing. So then the probiotic powder can do its thing in the gut and everywhere else. Yeah.
Great. Going back to the older dogs, when they get rescued or so on, many of them are not used to the toothbrushing. How do you get them used to that?
Yeah, it's they say that you can always teach a dog, an old dog too, any tricks. So this goes with with that as well. Us, we have to be the right person to teach something new to our dog, and our dogs are smart. We think we train them, but they're smart. They train us as well. So you have to just kind of have to get into that mindset that this is what we're going to do. This is how we do it. This is when it's done, and then celebrate after. So set the goals. Keep it short and sweet, and then celebrate after. I would keep. It's hard. I won't be able to teach you from here at this. You can. The answer is you can. How? Um, uh, it's a bit tricky, but you can. Keep it positive. Keep it. Um, as soon as it becomes stressful and you become frustrated, it's not going to happen. If you've tried anything before and it did not work, let that go. It doesn't work. You need to change. We need to change the strategy, something completely different. And then start from there and build on that. And then keep it short. It could be just 5 seconds at the beginning. It could be just a little, just touching the teeth here and there. And then that's it. As long as everybody's happy with that, that's the brushing for today. And tomorrow we do a few seconds more, or a few teeth more, or a different area. Keep it simple, keep it short, keep it sweet. Celebrate when it's done. It's easy, but it's not.
Would you be able to share with us some videos of how you do it in your dogs?
We at Pearly Whites, we're getting ready. We will come out with a bunch of videos to show you. All I can YouTube. There's tons of videos. My approach is completely different from what I've seen so far, and keep an eye on us. We'll come out with these videos shortly. Whenever I see this brushing business being done, in a fashion when your dog is facing you, and so you're facing each other, and then you just go in, and then your dog will let you brush. That's if you can do that, if your dog lets you do that, you're super lucky. Keep doing this brushing thing. 99.9% of the time, this will not work. Your dog can go all the way, like 360, up and down, everywhere. So this method, this face-to-face thing, it's I don't think it works. It works for a few, but generally speaking, it's not the right approach, I think. And whatever you tried before and did not work, do not do that ever again, because it's not working. It's not going to work again. You need something different, something very different.
All right. So I learned I'm in the 0.1% of people that can brush the teeth front to front as much as I want. He will just let me do it.
You have no excuse then. You have to.
Every night. Yeah, absolutely.
Good.
Okay. So another of the questions that we usually have is, what is the deal with those dental sticks and the toys that say like dental floss? The toy is like a dental floss. So there are those two products in the market: the daily, nightly dental stick, and what about those dental floss chewable toys? Do they work? And what do we really do with that?
Well, in my opinion, chewing is important. So chewing on the right thing at the right time, it's important. It helps. It helps not only to clean or keep the teeth clean, It also helps to exercise the muscles, and that's just as important. Like, that's part of the game. Like, chewing is great. So if your dog likes to chew, that's awesome. Keep her in that habit. What to chew on, that's a bit different story. Nylabone, that's one of the chew toys that I see and hear about. I personally really don't like it. That's plastic, so whenever your dog chews on it, the little pieces are going to end up, like, your dog is just going to eat those pieces, right? Basically. So I don't like that. Toys in general, yeah, maybe. I like the good old fashioned bully stick. It's natural, it works. We like dehydrated chicken feet, turkey neck, um, pig ears if it's from a good source. I like natural things, to be honest. Bones are part of it. I like bones. You just have to be cautious. You have to always keep an eye on your dog when you give your dog a bone. Okay, that's just a given. You have to keep an eye on your dog. Now, if your dog is a heavy chewer, if your dog is a heavy chewer, meaning that your dog gets into chewing and with this attitude of, I want to kill this thing, whatever it takes, you need to be cautious with bones, because bones, knuckle bones, antlers, no, they can really break a tooth, teeth, because usually it happens on both sides, actually. So I'll show you which one is. So these are the teeth, right? And so this is the tooth that breaks all the time, if anything, by chewing on hard things. So if your dog is a heavy chewer, be super cautious. Now, based on your dog's size, of course, different things can work. If you have a small dog, small things, small bones like turkey, chicken neck. There is the bone, there is the chewing, dehydrated versions or raw. If you have a larger dog, turkey neck, you can get different size of turkey necks, even big ones, raw or dehydrated. It's super awesome. There is bone, there is chewing. But those little bones in a turkey neck, for example, they're not big enough or strong enough to break any teeth. So they're safe in that sense. If your dog is not a heavy chewer and they just kind of play with things, other type of bones can be also useful. This bone thing is it's very dividing topic. It's one other thing. Ideally, bones should not be cooked. So either raw or dehydrated works. Raw cooked bones are not necessarily a good idea. They could cause trouble. That's for bones, yeah. Well, I grew up in a place, I'm Hungarian, in that part of the world. All dogs back then, when I was younger, ate all kinds of bones, cooked and raw, and it wasn't a thing to even think about that bones can cause any trouble, but studies show that they can, and they sometimes do cause trouble. So keep it simple: no cooked bones, raw or dehydrated. That's my opinion.
Great. The other question we usually have as dog owners is, so we were talking about if the dog has something wrong, go to the vet, but how do you know something is wrong? What are the signs of something is wrong in your dog's mouth?
In the dog's mouth. Okay, so change of behavior. that's always a sign of something in general. Like if your dog changes the behavior in general, there's a reason for it. So you want to investigate. If it's around the mouth kind of problem, then there are some obvious signs and there are some very hard to see signs. So the obvious one would be drooling. If your dog starts drooling, something's going on. If your dog is pawing at the mouth from one day to the next, there is something going on. Um, if your dog doesn't want to eat, that's for sure. That's a problem. That's a big problem then. Um, eye infection. It's not commonly known, I think. Especially those type of, not the obvious eye infection. The obvious ones happen, they come and go. But the one who you try, your vet or yourself try to deal with it, treat it, and it's not going away or it keeps coming back, then it could be a tooth related problem. And again, going back to the same thing, it's very likely the same tooth that I just showed you before. This tooth, I don't know if you can see it. So this one, this big one. So the roots of this big one, they go really far up and very close to the eye and the eye area. And so according to dentist vets, a large percentage of eye problems are actually tooth problems. Then it becomes an eye problem. So I'm not sure if eye doctors would share this opinion, but there is something to it for sure. It happens. So just keep in mind that if an eye infection happens and it doesn't want to go away, it could be a tooth problem actually. And then my personal favorite, like, but here's another thing. You can, when you feed your dog, you can, and you have a few minutes to spare, just wait and watch your dog, how she or he eats, on which side. Because if it's only one side, that's not a good sign. That means that on this side, there is something going on. So if your dog only uses this side always, today and tomorrow too, and the day after, there is something going on this side. And then to verify that, it's super easy. You look into your dog's mouth, you pull up the gums, and not only just here, just a little bit here, but you go all the way in the back, as far as you can go. And then you look at you notice the color and the texture of the gums, and then the buildup on the teeth. So, and remember that. And then you go on the other side. You again look for the color of the gum, the texture, how it looks, how it feels, and you notice the buildup on the teeth, and then you compare the two. It should be, the two sides should be almost identical, very similar. If on one side there's less buildup, you find, than on the other side, that's a problem. On the side where there is a heavy buildup, a heavier buildup, or more buildup, on that side, there is a problem. There is a loose tooth, there is an infection, there is something going on that side. And your dog is using the other side to chew only because dogs are smart. And they're trying to avoid the pain, right? So then they will use this side only. This side is going to be a lot cleaner, therefore, a lot cleaner than the other side. So that's an obvious thing. This is the first thing when we start working with a dog. This is the first thing that we check because it's a very telling sign of trouble, if there is any. So
What
this,
about the bad breath, though? Is bad breath a sign of something going on with the teeth?
tell me again, please.
Bad breath
Bad breath,
is a
yeah.
sign
Bad,
of something going on?
bad breath is not for sure. Like probably yes, there is something going on in the mouth. Um, Bad breath can also indicate a digestive issue, so it's not always exclusively a dental problem. It could be something else as well. Yes, you want to look into that for sure.
We just got a question from someone. How do you know if your dog has cavities?
Cavities?
Mm-hmm.
Dogs do not have cavities. It's very, 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 very rare. So dogs don't have cavities. Um, Cavities are something that German shepherds and labs are known to have. That still is very rare, but it's almost, no, I don't want to say exclusively because it's probably not true, but it's dogs, generally speaking, dogs do not have cavities. They have other type of there's okay, let me finish this first. So German shepherds, labs, and then the tooth that's involved in that problem is this tooth far back, the first molars, the upper first molars. Um, Almost ever, never something else. And then this goes unnoticed, I think, more often than not, because those type of dogs tend to have good teeth, and unless you are sure that there is something going on, you don't do x-ray, and without an x-ray it's hard to see. But for other dogs, cavity is not a thing. That's not something that we need to be really aware of or afraid of. There are other things. Now there is one other condition that's an interesting one. Oh, this is going to go far. Anyways, there's one other condition that could show signs of cavity, but that's actually not a cavity. That's another problem, and then it results in extractions. So when we, for example, notice that's also a no, that's an out of question thing, extractions are needed. And I can tell you all about that condition if we have time. I'm more than happy to go into that. But that's also, it's more of a cat thing than a dog thing. So cats have that condition more often than dogs.
Got it. And you transition very nicely to my last question before we go to the image. Breeds. So what are the breeds that tend to have the most issues? So you did touch on smaller dogs, but are there particular breeds that we should be aware that have more issues with the teeth?
The micro dogs, the tiny, little tiny, the super tiny, all breeds, any breeds. If it's super tiny, it's going to be a problem. Small dogs in general. And as we go into the picture that's coming up, I'll tell you more about that. Why they often, almost always have serious dental problems. Um, um, Let me think. There are a couple of things. Just as an interesting fact, Shelties, their upper canines are sometimes quite funky. They tend to stick out a lot more than they should. It's just Shelties, that's their own thing. Sometimes those teeth don't even grow in, actually. Another example would be boxers. Boxers have an interesting condition. It's almost exclusively for them. So whenever we see a boxer, it's the first thing. It is super obvious. It's impossible to miss. So often when you look into a boxer's mouth, you see tiny little teeth, tiny teeth. Now, the teeth are actually proper size, probably. But what happens is that their gums grow over the teeth, and they cover the teeth. So it's usually it's everywhere in their mouth, up and the lower. It involves all teeth usually, not often, not always, but quite often. That's a typical boxer thing. And then to deal with that, you need a dentist vet for sure. It's not a regular vet thing. And they shave off the excess gum, and then fingers crossed that it's not going to come back. It usually does grow back, unfortunately. So that's a boxer thing, for example. Doxies, as much as I love them, the first thing after comparing the two sides, the next thing in a doxy, we'll look for a condition that involves the upper canines, sometimes the lower, but mainly the upper, in my experience. That's also that's a big deal. Extractions, but the solution is extraction, and so they need to have those teeth extracted, likely. Now that involves an X-ray and the vet who's is actually familiar with the condition, but yeah, doxies have their own thing. What else I wanted to mention? So small dogs in general could be a Yorkie, Chihuahuas, most small dogs. Another interesting fact: small white dogs tend to have more dental problems than black dogs, for example. It has something to do with their gums, and their gums are more sensitive. And so I often compare that to a skin color kind of thing. So I can spend a day in the sun and nothing happens, and my daughter will burn in half an hour. So on the sun, so it's genetically we are more sensitive to certain things. Genetically, white dogs tend to have more sensitive gums than black dogs. It's not always the case. There are always exceptions to any and all rule. Generally speaking, this is true. Tends to be true. Mm-hmm. What else?
I'm gonna add the image, so give me a minute. I'm going to make sure that we can see it first. There you go. All right, so let us know more about these factors that play a role in our dog's health.
Yeah, so the reason I put together this little chart thing is because when it comes to oral hygiene, the next thing, and usually the only thing we talk about or we think about, is brushing our dog's teeth and chewing, maybe, and then these two. And then if you don't brush your dog's teeth, then we feel really bad if something happens, and then extractions happen. And I hear a lot of guilty. I talk to a lot of guilty dog owners and cat owners, and I think there is a significant piece is missing from this conversation of oral hygiene for our dogs. So I'm not sure if you can see this. I see it it's very small on my screen, so I hope you can see it and get the idea of what I was trying to show you here. So brushing is something that we can do and we can control. And so, as I said, there is so much more to this whole oral hygiene and dental health. So I listed all the things that play this is better. All the things that play a role in our dog's oral health. So diet, home care, lifestyle. Those three are something that you can control. You can actually control. You can control the diet. You can control the home care, lifestyle as well. Lifestyle, I mean chewing. Does your dogs play sports, catching the frisbee, the ball, that would be lifestyle. And there's a list of things that you have zero control over. And those things play a role as well. So On the chart, on this little donut thing on the right-hand side, please don't pay attention to the actual percentages because it's completely insignificant. Is the purpose of this picture is only to show you that there are so many factors that play a role, and this whole thing, the entire thing, is your dog's teeth, your dog's dental health. So the shape of your dog's head play a role. If you have a pug, problems will it's unavoidable. All kinds of dental problems will happen because everything is pushed in the face, right? There isn't enough room for all the teeth to grow in properly. So the shape of the head plays a role. Age plays a role. Young dogs, healthy dogs, everything's great. And then as soon as they start to age and the health, the overall health start to decline or deteriorate a bit, dental health will change. Dental health, the health of your dog's teeth and gums will change as well. It will, everything shows up in the mouth. Crowding, it's a big one. And this is where all the small dogs come in. Crowding happens when too many teeth grow into a too small space. And where is not enough space in a dog's mouth, then the teeth are going to be on top of each other. That's crowding. Those teeth will not last. You can do the best brushing. You can do the best diet. You can brush your dog's teeth twice a day. Bring your dog to see us every 3 months. Do the under anesthetic cleaning. Those teeth will not last. It's unfortunate. Rotated, overlapping teeth, same thing. Often pugs, Shih Tzus, their teeth are, instead of being nicely aligned, like just in this this little chart, like everything is straight and in a nice line. When a teeth can't find a proper place to grow in, there isn't enough space, they will rotate. And when they do that, it's a long story, but the roots of those teeth, it usually involves the premolars, or it could involve any teeth actually. But when it involves, for example, a premolar with two roots, the roots, instead of growing into the bone that holds the teeth in place, instead of growing in properly, when they go sideways, those roots are not embedded properly in that bone. And so they will not last. They will be fine for a while, and then at some point, they slowly become loose, and then it's going to be a problem. Extractions need to happen. Genetic predisposition. Genetics, yeah. So poor genetics, like we can blame a lot on genetics, and dental is no different. There is a significant portion of dental health is related to genetics. You have to be lucky in life a little bit, right? So that's the genetics. Retained baby teeth. That's usually is a small dog thing. So frequently, the baby teeth do not fall out on their own, and then they need a little bit of a help. It's often the upper canines or the front teeth. Some dogs have 2 rows of teeth. Extractions are recommended. Absolutely. Now that's something that fairly easily fixable. Interesting fact: if you have trouble deciding which one is the permanent tooth and which one is the baby tooth, for some reason, it's nature, the permanent teeth are always in front of the baby. So the baby is in the back, the front, the permanent tooth is always on the front, always front of the baby tooth. That's just how it is. Deformed teeth. not a common thing in my opinion. On that note, going back to breed specific things, it just reminded me that standard poodles have a condition. Their teeth, like it's actually quite often the case. Like we see a lot of those dogs. Their teeth are brown. Like that pearly white thing is just not happening for them. It's the teeth are healthy, but they're not white. They're just discolored and sometimes deformed as well. Deformed teeth will not last. Deformed teeth will cause problems. They will become loose. They need to be extracted, and they're just trouble. Under and overbite, yeah, we do see that often, right? Especially with small dogs. Uh, it's cute. It's a cute thing, but it's not a good thing. You can't change it. You can't do anything about it. But what happens is, here's what happens often. So when there is an underbite, for example, often the upper teeth are pushing the lower teeth. And every time your dog closes his or her mouth, there is a tooth-to-tooth contact. It's the same thing with upper overbite. There is a tooth-to-tooth contact. And when that happens, the teeth that are touching are not going to last. Unfortunately, eventually, those teeth will become loose and they will become a problem. With underbite and overbite, you also want to make sure that the teeth are not literally digging into the, sometimes the lower canines are go as far as going into your dog's palate, and then there's a hole there. So each and every time, it could be painful. Actually, it could be really painful. So under and overbite, it's a cute thing, but it comes with consequences for sure. Size of the teeth. It's again a small dog thing usually. Larger dogs have proper sized teeth. Sometimes, quite often actually, small dogs have disproportionately larger teeth. Larger teeth than if you were to compare the size of the dog, the size of her teeth, and the size, like you look at a larger dog and the size of that larger dog's teeth, and you do the comparison, it's often quite shocking how large those teeth can be in a small dog's mouth. And then there is the bone again that holds those teeth in place. They're just not strong enough to keep those teeth for 15 years. And also yeah, it's a small dog thing. It's very much of a small dog thing. Yorkies, Chihuahuas, they tend to have these type of issues. It's too big, and then also with that size, there isn't enough room, and then comes the crowding. There isn't enough room in that small little mouth for all those teeth to grow in properly. So crowding, overlapping, rotated teeth, problem. So, and then lastly, the mom's diet during pregnancy, that also plays a role. So you have zero control over that. So back to the picture, I just wanted to tell you that there is only so much that you can do and control. And there's a whole bunch of other things that you have zero control over, or very little. And so then when it comes to our dog's teeth, in my advice, do your best, um, do your absolute best, keep your dog healthy, but please make peace with all those other factors that you have zero control over, because they play a role, and the dental problems happen often. So be in peace with that. Yeah, I hope this was helpful.
It was, Renata. Thank you very much. I appreciate your time and teaching us so much about what to do and not to do. And I agree, there are nuances and exceptions, but this is a very good introduction to how to
Thank
do it, when to do it, when to seek help. So I appreciate it. And I hope to have you back eventually for
you.
another session.
Thank you so much. It was
All
fun.
right. Thank you. So bye. Bye, everyone. It was nice seeing you.
Bye.